Solidarity forever, for the unions make us strong.
Ile kaunti ambao haijalipa mishahara kufikia Jumatatu asubuhi, tunasema wahudumu wote wa afya wataondoka katika zile mahospitali.
The strike notice means patients who will turn up to seek medical services in public health facilities will be stranded or will be turned away over delayed salaries. Leaders of the Health Workers Union on Thursday morning at a press conference called for work boycott, saying that over half of the counties are yet to pay doctors and nurses their salaries. Nurses in some counties have reportedly started a go-slow ahead of the intended nationwide strike.
If these things don't come to a stop, we will no longer go to the counties to try and negotiate. We've done this for 8 months, it's not worked. We are going to call a mammoth nationwide strike, and take it from me and from us, this time we are not calling it off until everything has been sorted conclusively. On Monday, if there'll be no pay, no work.
Some county governments have blamed the national government for the non-payment of health worker salaries, while the national government has already distanced itself from the crisis, saying healthcare is a devolved function. The Kenya Medical Practitioners and Dentists Union Chairman Victor Ngani says it is impractical to expect doctors to work when they can't meet the basic needs.
Because you cannot work without pay. We are not asking for any extra money. We are simply asking for the salary you've worked for. Because rent has to be paid. School fees have to be paid. Our children have to go to school. We have to eat.
Next to him.
The workers have vowed to support the call for a referendum by the Coalition for Reforms and Democracy Code if the referendum addresses the demands for the formation of the Health Service Commission.
Na wameniambia wako tayari kujiunga na referendum Kenya mzima, na wako tayari kuchukua sahihi milioni 1 kwa wiki moja, lakini kama code itaweka mambo ya Health Service Commission kama mojawapo ya swali kwa hiyo referendum.
We were told if you want to align healthcare, if you want to put Health Service Commission, you need a referendum. And therefore, as health workers, we will support a referendum with the Health Services Commission. And this goes out clearly. It is our ambition, and if we are not accommodated, we will create our own.
They have also accused members of the county assembly and governors for misusing funds meant for health and also for politicizing health matters in the counties.
These guys are just after money. Wanafikiria hizi mabilioni ya health ni ya kukuliwa. Hapana, ni ya kupeana huduma kwa wananchi. Na waache kurukaruka na mandeke na kukwenda Seychelles na South Africa. Wajue kwamba responsibility ya health tunataka watu wapate afya.
We have MCS taking money for healthcare with the governors. They go with them for trips, bring paracetamol to the hospitals, then they say you brought drugs. The health workers are selling drugs. Can you treat malaria with paracetamol? If you have cancer, will you be treated with paracetamol?
Well, this is not the first time health workers across the country have called for a strike because they've not been paid their salary and because of the poor working conditions in public hospitals. Now, the health workers have vowed that their call for strike will not come to an end until the government pays them their dues. Now, Kenyans are waiting to see whether Health Cabinet Secretary James Macharia will come to their rescue to ensure that health services are not paralyzed in public hospitals come Monday. Brenda Czeda for Abro Africa News at the Central Business District, Nairobi.